Vein disease encompasses problems with deep and superficial veins. Deep veins carry most of our blood from our feet to our heart, but deep veins can get a clot, can go to your lungs. Sometimes we have to remove that clot, and in order to help the patient's symptoms, which are typically pain and swelling. Venous insufficiency is actually a valve problem, and they're usually problems in what we call superficial veins, just a little closer to the skin than the deep veins. When the valves aren't functioning anymore, which is something you inherit, the blood can actually flow backwards and flow towards the feet instead of towards the heart. So typically it is safer to close those veins, the superficial veins, than keep them open going backwards. And the way we close them is very simple. We can use heat thermal ablation with radio frequency or laser. At our clinic, we tend to use both. And then the newest up and coming way of closing those veins is with a glue. And it's done all the same way. We put it through a tiny little catheter, either heat or glue the vein closed, so it no longer refluxes or goes backwards. In addition, some people have large varicose veins because there's backwards flow in the superficial veins, and so we do all-encompassing care, including ambulatory phlebectomy, tiny little incisions, no stitches, pull out the big varicose veins that can potentially clot and cause pain. And the last thing that we do is we also use medicine to close these veins. If there are larger veins underneath, we use ultrasound guidance and put medicine in there to sclerose them shut. If you've ever heard of spider veins, we also close the spider veins on the skin surface with medicine using tiny little injections. Vein disease is much more common than arterial disease, usually 4 times more common than arterial disease. It can cause a variety of symptoms, including pain and swelling. Other symptoms can be itching, tiredness, heaviness, cramping, restlessness can all be due to underlying venous insufficiency. This is a genetic problem. Men and women get it. It is more common in women. It is more common in obese patients. Symptoms can be present at any age. Varicose veins can be seen as early as childhood and when you're a teenager, and then the symptoms may progress from there. Someone who's predisposed to venous insufficiency may see symptoms worsen during pregnancy, and typically the more children a woman has, the worse the vein disease can be. Sometimes the vein disease is present during pregnancy, during the first or second pregnancy, and symptoms resolve, including the bulging veins, but as they have more children, typically that may not resolve. Also, anybody predisposed to having venous insufficiency and valve failure can have their symptoms exacerbated by careers that require them to stand for long periods of time. So anybody standing, not being able to rest or put up their feet, that's when the symptoms can present faster if they have that type of occupation.